Hello, everyone. Once again, happy Monday. Here we are, Monday again. The week seemed to just fly by. So I hope everybody had a good weekend. And thank you guys for re-registering for the Zoom calls. So we were having some technical issues, and every once in a while it is good for us to kind of refresh and get a new meeting ID and refresh the Zoom call information. So thank you for re-registering. Okay, so we are going to start off here with our questions that have come in. And then we don't have a lot of questions. And obviously the Wednesday call last week, Dr. Connors canceled kind of last minute, had something going on. So apologize for that. So we'll get these questions answered. Just entering people in here. Let's see. Okay, so here we go. The first one. So, with my pancreatic cancer case, I'm told to avoid dairy. I wanted to try the Budwig protocol that has cottage cheese. I understand that the flax oil in the recipe counters the dairy when mixed properly. Can I safely use the Budwig protocol knowing this? Yes. So, this is kind of the one exception we allow when we've asked you to avoid dairy on your protocol. We do support use of the Budwig protocol. So, it's kind of the one time we make the dairy exception is when you are doing the Budwig protocol. So certainly you can start that, and it is a good idea to ask us, ask us about this prior to starting. Um, for one reason, just to kind of get it in your notes that you're trying the Budwig protocol, but then there might be a scenario where we really don't want you to do it because of the dairy, but most often it is fine. So yes, you can add that to your protocol. All right. Question about foot bath programs. Excuse me. So this person is referring to the new programs. She just got updated programs, and she says the first time I did program 3, it came with a stench. Today I did program 3 again, and now my hip joints hurt. They did not hurt before this. What do you think this is? Do you think it's just temporary? Any ideas to bring comfort? So what do we think it is? Well, it's kind of hard to say exactly what it is, but certainly when we are introducing new things to a protocol, so in this case, we've got some new frequencies that she's introducing through the foot bath. It is creating a response within the body that is different than something you probably have previously experienced. So certainly could be just your body's response to these frequencies. Um, the programs that you're running are most likely cancer-based frequencies for your specific diagnosis. And therefore, certainly if there's any, cancer in the hips, I don't know that there is for this particular person. I don't think there is, but anytime again, you're just introducing something new to the body has a response, and maybe it's just some inflammation in that area because for whatever reason, that particular area is where the inflammation is, just kind of going to for whatever specific reason. So, certainly just stay hydrated, keep up with your supplements, take it easy. Maybe you space out your foot baths a little farther. The stench that you reference, and kind of the colors, that's normal. It is normal to have some smell, some odd smells when it is relating to the foot bath. And certainly the color change is normal as well. Yes, I think it is just temporary. Your body will get used to it and your body will adjust. And as we get these frequencies into the body, they're creating the response and doing their job. So we're fighting that cancer, and, if you're doing some detoxing frequencies, we're getting the toxins out of the body. So it's all good. I think it is just temporary. Just give yourself a little extra rest and a little extra TLC. Don't push things. It's probably just a little bit of an inflammatory response. So anything that is anti-inflammatory can help bring you some comfort. So curcumin can help, boswellia can help. I don't know if you have the Alova Immune product, or excuse me, the Alova Limitless. That's the one that is made from beet roots, and that has the active ingredient of the betalain, which works really great as an anti-inflammatory. So you could try that. You could try some inflammation programs on the Rife machine as well. And so here she's referencing the colors of the water. Yes, so the colors get very murky, so that is normal. Okay, so this question is referring to blood work, and they're kind of going into details on the specific results of their blood work. The bottom line is that they have some low white blood cell numbers, a specific white blood cell and neutrophils are coming up as low. So anytime somebody sends in a question regarding labs, we can't really give a true recommendation or a true analysis of what's going on because I personally have not looked at your labs. And for this person, I don't know, I'm not working with them one-on-one. And so I don't know the health history background, what exactly they've got going on. So I can't give specific recommendations and I can't tell you exactly what's going on with these results for those reasons. If you do want specific information regarding any lab results, you do have to schedule with Dr. Connors, that one-on-one appointment to go over the lab work and he can give you his opinion. So with all of that being said, we can kind of talk in general terms. So what we're doing with the Zoom calls is kind of trying to educate and speak in general terms. So again, this is not a specific advice on what to do based on this scenario because I don't have all the ins and outs of this specific scenario. So in general terms, when we're talking about white blood cells and having low white blood cells, it's white blood cells are for inflammation. So they're part of the immune response in attacking pathogens. And so that can create some inflammation. And so having high white blood cell counts can mean that your body is fighting that infection and creating some of that inflammation. So in this scenario, she's got some low white blood cell counts. And so what are reasons then that can happen? Well, certainly if anybody is on chemotherapy, that messes with your blood cell counts and certainly can lower white blood cell counts. And that's one of the reasons that they are checking levels. They don't want your white blood cell count to get too low because then you are vulnerable to infections and they may even skip a chemotherapy session if blood cell counts are too low. So it could be, I don't know if this person is on chemotherapy or not. Could be because of that. Could be when there's low white blood cell count. It could be because of a chronic viral infection. It could be, other kind of blood issues going on. Could be stress related. There's a number of reasons that blood numbers can be off. And certainly this is just one test. So Dr. Connors has talked about this a lot. When we're taking lab results, we have to kind of take things with a grain of salt. This is just one snippet of time at that moment when you are having your blood draw, and lab values do depend on what's going on in that certain scenario and the blood that they've collected at that time. That's not conclusive of exactly what's going on within the body. It is a tool. So it gives us a part of the picture, but we, kind of need to look at multiple lab results and see trends and not just hyper focus on a specific blood level. So in this case, what can we do to kind of naturally boost white blood cell count so we can, do anything that can increase the immune system to help just boost the immune system? There's supplements you can take. Evolve Alova Immune. So that's a great supplement to help boost the immune system. So if you did a Google search on or not a Google search, but a search on our web store for just immune supplements. We have an immune boosting bundle, so you can, kind of look at the supplements there. But anything to help stimulate the immune system, you can certainly run programs on the Rife machine to help stimulate the immune system. There is a vitamin C program on the Rife machine. You can run that. You can take vitamin C, you can take garlic. So anything to help with that. And certainly just, getting adequate nutrition. Make sure you're getting, enough fruits and vegetables, antioxidants, you're getting enough sleep. So all of these things that we're asking you to do in your protocol are all to help, normalize function throughout the body. So hopefully that gives you some ideas to kind of help boost white blood cell count. And again, without knowing the specifics of this situation, this is just general advice and education. Okay. Next question. So this question is, being an older female and since I am on a no dairy, low histamine diet, should I be taking a calcium supplement? So I encourage all of you and this person in particular to check out our blog and just type calcium into the search bar, and you will come up with this article here that Dr. Connors wrote talking about calcium and should I take a calcium supplement? And here are some of the key points in that article. So really calcium, first of all, it kind of depends on the reasons why you would be taking calcium. I'm assuming in this scenario, she's concerned about bone health. And really all of our minerals, calcium included, we need to be looking at the form because there's lots of junky forms of minerals that really do nothing for the body. Calcium and all minerals should be taken, as close to a whole food source as possible. So we get minerals from our foods that we eat. So if we're eating a variety of fruits, vegetables, plant-based foods, we are getting minerals there. Yes, you can supplement, but again, it needs to be in the right forms. And if you're looking at our store and you do a search for minerals, those minerals that we have in our store are the correct forms. They need to be bound with something, attached to something, like a glycinate or a specific molecule, a proper molecule, so that your body can absorb them. So calcium carbonate is basically, not a good form. That would be like eating a rock. Your body just can't absorb some of these lower quality forms of minerals that, you would buy at Walmart or CVS or something. So quality matters. And so take a look at our mineral supplements. They're from, or there's a patented place, for proper minerals in supplement form, and that's called TRACS. So that acronym TRACCS is kind of what you're looking for quality mineral forms. And then Dr. Connors notes in this article that you should not exceed 500 milligrams a day. Too much calcium is not good, even in the correct form, can, cause some buildup and affect the cardiovascular system. Needs to be balanced with other minerals and nutrients. So taking something like our Clear Multi-Min Plus that does have calcium in it would be something that would be good. So in combination with other minerals, calcium deficiency is not the cause of osteoporosis. And so, if we're looking to prevent osteoporosis or, help treat osteoporosis, calcium is not the best way. Taking calcium is not the best way to work with that. Osteoporosis is an inflammatory disease, not a mineral deficiency disease. So we do have a bone building bundle that you can take a look at. And Dr. Connors talks about the best ways to decrease inflammation in the bone using a product called T-Vigo that's high in EGCG, which is the best way to reduce inflammation, that IL-6 pathway that triggers inflammation in the bone. So taking that would be good. And then he states that taking Fosamax or other similar drugs to prevent bone loss, plain and simple, just does not work. So certainly calcium can be taken just in general to support, mineral function and health. But that's not the best way to support bone health. So some of those other ways, and if you look at that bone building bundle, that would be a better way to support bone health. So certainly read this article. It goes into more detail about that. All right, spending some significant time a little bit off grid. Electricity, but no running water. How will my foot bath do with rainwater, with creek water? So this is awesome. I'm glad you're getting off grid and taking a little bit of time with nature and away from the hustle and bustle. So that is therapy in itself. So enjoy your time. Certainly, you can bring your Rife equipment and foot bath. And while I don't know specifically the answer to this question, I cannot imagine that there would be any problem with using rainwater or creek water. Obviously, you still want to put the salt, the sea salt or the Himalayan salt into the tub and try to get the water to be as free from debris as possible. But really, it's just the water itself, the hydrogen and the oxygen, that are creating the conductivity in combination with the salt to help with the foot bath and the frequencies entering the body through that conductivity. So I don't see a problem with it. It might change conductivity, depending on, what minerals are in the water and how much salt you use, it does change the conductivity. So I don't know. So you might have an increased accelerated response with the frequencies in your body. So you'll just have to watch for that. But certainly I don't think there's a problem with the Rife itself and using rainwater or creek water. So I would say go for it and let us know how it goes. All right, general question regarding CT scans and how accurate they are. I've had 3 CT scans of the pelvic area now for colorectal tumor, 2 with contrast, 1 without. I'm using these to measure progress. The only problem is that they are very inconsistent. Also have had several MRIs done, all done since March 11th of 2020. So yes, so certainly no test is perfect. So what you are experiencing, you know, absolutely, there's inconsistencies. And I'm going to let Dr. Connors go into more detail on this on the Wednesday Zoom call. I believe this person, he was referencing Dr. Connors, but I just thought that I would throw part of his question in here to just kind of address this in a more general way because, it is a common question. We get lab results back, just like we spoke about moments ago, lab results back and we're focused on one part and what do these results mean? And, really it's when we are looking at the trends in these results where there is value. And certainly in relation to other results, do these results align with how you feel? Do they align with other test results that you're getting? So take every test with a grain of salt. There is no perfect test that gives you an exact kind of reading of tumor growth or size or where you're at. So certainly you're in a different position when you have scans, CT scans and MRI scans. There's no way to be in the exact same position to truly exactly measured tumor. So you might be at a slightly different angle. So they're getting a slightly different measurement. So everything has kind of a margin of error. So there's small changes in size, is it within the margin of error? And is it, consistent with other scans or data that we're collecting to really assess how you're doing? So I have to check for that. Certainly technology can be different. So if you're, I don't know if this person is going to the same clinic using the same machine. So technology can be different depending on the machines that you're using. Just kind of a little personal story here, and I hope people don't mind that I share personal stories once in a while. I know this call is about you guys, but just having my own cancer experience with my husband, I can relate. And this question reminds me of a time when my husband had brain cancer. So he was diagnosed almost 11 years ago. Doing great, doing well, but has, had a number of MRIs to just kind of check. And it's probably about 5 years ago, he had an MRI and, the red flags were up. Something was different on this one. And the oncologist kind of immediately went to, okay, this has changed. We think this is growth. We need to get you in for that biopsy. You need to schedule with your neurosurgeon right away. And so, of course, all of these, horrible gut-wrenching feelings come up, and you're panicked and you're afraid, and you don't want your mind to go to these dark places, but you can't help it. So we scheduled the appointment with a neurologist, and a few days later, and sitting for hours in the waiting room. I'll never forget, I swear we were waiting for 2 hours for our appointment. He was behind schedule, and the whole time, my mind is stewing like, oh my gosh, here we go again. It's been 5 years. Everything has been going so well, and just that total, you know, blow to the gut and to the heart when you think you're here we go again. And so we get into the meeting with the the neurosurgeon, and he is just kind of like, well, hold on a second here. I know the oncologist, wants to stay ahead of things, but they're jumping way too far ahead. We have had an update in the technology on this MRI machine. And so in this particular scenario, he said that he really thinks that the changes that we're seeing were because of this update, this new technology, where the change might have not been picked up in the previous version because it just wasn't as sensitive. And now they've done this update and it's more sensitive. And so it's showing something different, but doesn't necessarily mean that it is growth. And so obviously was music to our ears, to think, okay, this isn't, we don't need to jump to that conclusion. We need to just weigh this. And in this case, that was exactly what it was, and he said, so let's just wait and not jump there yet. And we'll come back in 3 months and check, do another MRI and see. And at that point, if we do see changes, then we might need to do some more investigating. But so we did that. We followed up in another 3 months, and everything was fine and stable, and all is good. And now it's been almost 11 years. So all of that story is just to say technology changes. Nothing is perfect. We can't get hung up on one scan. We need to look at trends, not just one result. So, like I said, Dr. Connors will kind of go into more detail about the accuracy of scans and results, but I just wanted to kind of touch on that. And thank you for listening to my personal story, but I think, it relates, and I hope that it can kind of help. And I love hearing all of your guys' stories because certainly I can relate and just know that we feel for you every step of the way, and we are here to walk with you alongside all of the test results. And even though we have to stay in our lane and we can't make recommendations from a conventional perspective, we do understand, and we'll do the best that we can to support you with every step and every choice. So that was all of the questions that came in. So now we'll kind of look at chat questions. Let's see. Seems like the new Rife programs are not causing any pain like the old programs. Is that normal? Certainly it can be normal. Do know that when we have changed your programs, we're not, as far as cancer frequencies are concerned and individual diagnosis, we're not removing cancer frequencies. We are just actually concentrating the cancer frequencies. And, so Dr. Connor's programming was a little different than Michelle's. So if Michelle originally programmed your equipment And now the new update, you might have just 1 week's worth of programs where you had 2 or 3 weeks with Michelle. So really, Dr. Connor's um, way that he is approaching the rife frequencies is, to kind of concentrate and specify for the cancer. And he wants more time, obviously, spent with those cancer fighting frequencies, whereas there was some ancillary things that were maybe tested and they were in Michelle's programming. And you certainly can run other things on the general programs with the Rife machine, but the programs Dr. Connors have created are concentrated cancer fighting frequencies. So you're not getting less of anything cancer related. And then from the change from just the new version and the update, again, we're not changing those programs. We're just changing the order of the frequencies and how the actual programming is done because it needs to be done a little different from the version 5 software to the new version 6 software. So all of that being said, the way your body responds, if you're feeling like your body is responding a little differently, it, yeah, absolutely can be normal. Your body might respond differently just because it's a different time. Your body is more used to those frequencies now. We've done a lot of that preliminary work and adjusting, whereas it was new, and so your body had a lot of adjusting to do. Now your body's used to it, and it's worked on some of the detox pathways. So your body changes, and so your body's response can change. So can be normal. Does vitamin B17 help with killing cancer? So yes, so it can be a cancer fighting supplement. We do test cancer fighting supplements. So the supplements protocol that we have you on, if it does not include B17, that's because it wasn't testing as the best cancer fighting supplement for you specifically. Does not mean that you can't add something if you feel compelled to do that. It just means that we have created a protocol based on our testing, which includes the cancer fighting supplements that tested as specifically for you to balance your cancer. So we want you to take those. Anything that you take in addition to, you certainly can. Um, and with subsequent testing, different things might come up. So B17 can be, yes, a cancer fighting supplement. Does Gerson protocol lower white blood cell count? I have read that a lot of raw uh, foods can kind of change or lower white blood cell count. So possibly, I don't know that for sure, but I did read something indicating that that might be a reason for kind of a low blood cell count would be eating a lot of raw foods. Um, so you can take that into consideration. I did my foot bath this morning with creek water, used salt as usual. The water wasn't as murky as usual. I did get a few burps from the machine though, and thoughts. So yes, so different, minerals and different composition of the water can create, different conductivity. So I'm glad that the color of the water did change. So it was working, but not as murky as usual. So again, just could be because of the different water that you're using. The burps are normal from the machine. And that just is because of the hydrogen that is on, uh, what the metal plate is doing is kind of attracting the hydrogen atoms, the positively charged atoms to one side and the negatively charged oxygen atoms to the other side. And then, it's creating that conductivity. So those burps and bubbles are from the hydrogen, and that is normal. So that's fine as well. All right. So fun. A foot bath in nature with creek water. Sounds like a perfect scenario. I'm glad you did that. All right. Any other questions? Don't see anything else coming in. So just a reminder, as usual, to utilize that patient membership site and the little search bar here. So if you're doing a search from the actual membership page, it's not going to bring up just content from the membership site. If you're doing a search, it's going to bring up content from the blog, which is great, you know, to do a search from the blog. But just an FYI, somebody was asking about that. So yes, but utilize that blog, utilize the membership site. It's the best place to go to get announcements and information. Past Zoom calls only shows videos from 322. Am I missing something? So yes, so on the Zoom call page, so if you click this little tab right here, it brings up, you know, all of the information about logging into the Zoom call, all of that stuff. And then towards the bottom, there is a video, a snapshot of a video screen. There's a tab that says Dr. Connors, and there's a tab that says Anne. And so those are, you know, Dr. Connor's Zoom calls if you're on his tab, and mine if you're on my tab. So those are kind of the most current Zoom calls, and it's on a playlist. So every call that we record, we add to a playlist. And so the most recent recording will always be the one that is viewed in that screen when you click on those tabs, and you can actually click on the middle of those images there and it will play the recording. So the most recent recording is always that first one there. And if you were to just let that, you know, you listen to the whole thing and it will just scroll or loop into that the next Zoom call from the previous week. So again, a playlist is showing just housing all of those Zoom calls. So you can access all of those. The same with mine. So I think this is maybe my sixth one. So all six of those are on a playlist. And if you watch that first one and let it go, then it will loop right into that second, third, fourth, fifth, sixth one. So you can watch all of those. That button on the very bottom, that says you can click on it and it says a link to past Zoom calls. Yes, that only shows it shows starting from, you know, 2017 or something, and it goes through more current ones. But the last one that's listed there is from 322. So that's kind of the old way or the previous way that we were logging all of the Zoom calls. So we just had that log and we'd copy and paste the link, and but now the more recent ones are on the playlist embedded within those tabs on that Zoom call screen. So hopefully that helps. That's a, a good question, and that's not the first time that question has been asked. So good question. You are very welcome. All right, any other questions? All right, I don't see any other questions coming through. So you guys have a wonderful rest of your day. And keep sending in those questions. Dr. Connors will be back on the Wednesday Zoom call, and look forward to talking with you guys again on Monday. Have a great week. Bye-bye.